And welcome to The Verdict. Mick Cornett with Kent Myers. We're glad you're here with us. And today we're going to discuss an issue that is very important to the future of Oklahoma and something that we're not necessarily proud of but have to address.
Yes, it's our health.
Yeah.
We had a very poor statewide rating recently in a statewide or nationwide test on the health of our citizens. Being responsive as the governor is and his commissioner of health, they have implemented a new program that we're going to talk about today. And you were mentioning to me something about this new fast food rating that came out recently.
You know, we finished first, if you want to call it that, amongst cities in the United States as far as the opportunity to go to fast food restaurants. The average Oklahoman goes to a fast food restaurant 21 times a month. That's actually Oklahoma City, not Oklahoma. Oklahoma City, 21 times a month. That's scary.
Well, that's an awful lot of fast food.
It is.
And it translates into perhaps some health problems.
Mm-hmm. Well, yeah, you would think so. We do have health problems. We eat too much, we don't exercise enough. What are we doing about it? That's today's subject on The Verdict.
In driving rain, blistering heat, and bitter cold, 365 days a year, 24 hours a day, Chesapeake drills non-stop for natural gas on American soil. Chesapeake drills more new gas wells than anyone else, and from those wells collects the most drilling information and acquires more 3D seismic images, leveraging every efficiency to improve the odds of finding more natural gas every day with every well we drill. The better job we do of discovering bigger reserves of clean-burning American natural gas, the greater the prosperity of our nearby communities, our state, and our nation. And as long as there are more gas reserves to be found here in the U.S., we will never rest. Chesapeake. Natural gas wins the day.
Welcome back to The Verdict. Mick Cornett with Kent Myers, and Kent's going to introduce today's guest.
We're very pleased today to have Dr. James M. Mike Crutcher, the Commissioner of Health from the state of Oklahoma, with us again for his third visit to The Verdict. Dr. Crutcher did his undergraduate work and his medical school work at the University of Oklahoma, got a master's in public health from Johns Hopkins University, was 14 years as a naval flight surgeon, and then came back to Oklahoma. We're glad about that. Came back and joined the health department and has been commissioner and the governor's cabinet secretary for health for a number of years now. Mike, welcome back.
Thank you. It's good to be here.
Mike, tell us what's going on in your office and in the governor's office trying to correct the problems that people in Oklahoma have with their health.
Well, this initiative called the Strong and Healthy Oklahoma Initiative is the result of, I think, something we're all aware of in the United States today is that Americans, instead of getting healthier, are getting sicker, and our health is not good. And a lot of that is related to chronic diseases. Heart disease and cancer and stroke and diabetes is what's causing the problem. And we realize that we need to take some action against that. And this is Oklahoma's effort to try to encourage people, as the slogan for the initiative says, is to eat better, move more, and be tobacco free, the main risk factors for contributing to poor health of our population.
Mick and I were talking during the opening about Oklahoma's position relative to other states in regard to the general health of its citizens. Can you comment a little bit on that?
In most of the indicators that are used to measure the health of a population, Oklahoma rates in the bottom 10 of the country. For some, we're worse than others. Our overall ranking by a group called the United Health Foundation that issues a report every year is we rank 44th overall. But there's one of those indicators for which we rank dead last in the country, and that is the deaths from heart disease. More Oklahomans die every year from heart disease, myocardial infarction, heart attack, and other forms of heart disease than any other state in the union right now.
Let me follow up on that. What's the leading cause of death of Americans generally?
Heart disease is, and heart disease always will be. The problem that we have is that people are dying younger of it in Oklahoma than in most other states. I think ultimately your likelihood of dying from heart disease is greatest, but you'd like that to happen when you're 85 to 90 and not when you're 65 to 70.
Well, in summary then, we're 44th overall, but
Right.
in the leading cause of death,
Right.
we're worst.
Yes, absolutely. We rank at the bottom of the country. And actually, I think it's going to be difficult to change our overall rankings significantly unless we can have some impact upon decreasing the prevalence of heart disease in the state, because we are just so far beyond the national average in that, then there's a great deal of opportunity for improvement if we can do it.
And these health issues affect business and industry across the state.
Oh, absolutely. In a lot of ways, I think everybody understands is that the healthier your population is, the less likely they are to take time off with illness, the more productive they're going to be on the job, and also the less the healthcare costs will be for providing for your employees if you don't have people that have a lot of chronic diseases such as diabetes and heart disease or cancer. Those are very expensive diseases to deal with, and employers will pay the costs of that.
Is it part of the culture? I mean, is it passed on from one generation to another? Is this just something that we need to work on generationally, or is this something that's just come up here in the last few years?
Well, I frequently say that in the United States we're a victim of our own success in many ways. I mean, we live in a very affluent society in which there is ready access to relatively inexpensive and very tasty food, but it's also sometimes not very healthy food, high calorie and not very healthy, and so we take advantage of that, unfortunately. We also live in a society where people don't have to work physically very hard all day. We've transitioned from our past to the times now. So we've got a society that is eating too much, not exercising as much as it used to, and unfortunately using tobacco products too much. So we've kind of brought this on ourselves over the last few decades.
I would expect that the answer you're going to give me to this question is not very encouraging, but where do Oklahomans rank nationally, generally speaking, in the use of tobacco products?
Well, again, in the bottom 10, we're generally about 45th or 46th, and those numbers are a little old in that I think some of the efforts of the last few years, such as the clean indoor air laws, strengthening youth access laws to tobacco, and the tobacco tax, I think we'll see benefits from those in the years to come. But right now, we still rank about 46th.
The tobacco tax is something that the citizens voted
Right.
affirmatively to impose
Right.
on themselves a couple of years ago.
Right.
And I guess it's a little early to see how that's shaking out.
Well, I think some initial statistics that we have indicate that consumption of tobacco products is going down in association with raising the price, and that was certainly from a public health perspective the intent of that. If that you can raise the price of a product, you will decrease the likelihood that people will purchase that product, and especially for teenagers that have very little discretionary income. That was the intent. It's been shown to occur in every other state in which it's happened, and we're starting to see that happen in Oklahoma also.
Do health issues vary by sex, by age? Is there one part of the demographic breakdown that we're doing very poorly in?
Well, if you look at heart disease, it's pretty much distributed across the population. We have elevated rates in both the male and female population. We have elevated rates across the different racial and ethnic groups in Oklahoma. So no, I can't say that it's focused in any one particular area that we can just focus all of our attention on.
What about city versus rural? How's that shaking out?
Well, we see higher rates of disease in rural areas in general, and not in everything, but our total death rate, our cardiovascular disease death rates are higher in rural Oklahoma than they are in urban Oklahoma. When you define urban, and that gets to be fairly arbitrary, is how you define urban versus rural, but when we separate out Oklahoma City and Tulsa and Cleveland County as really the urban areas of the state and compare that to the rest of the state, there are higher levels of disease in rural Oklahoma.
I noticed when this program of Strong and Healthy Oklahoma was announced, it was announced by the president of Blue Cross Blue Shield, a good sponsor of the verdict, I might add. There apparently is a collaboration between private industry and the governor's office and your office to promote this program and to make it successful. Can you talk about that collaborative effort a little bit?
Well, I think when you get into this issue and look at what we're trying to do is to encourage healthier behaviors of people. It's going to take a lot of different collaborators, a lot of people working together, because there is no one easy way to do it. The slogan, as I said again, is eat better, move more, and be tobacco free, where we live, work, and learn. So we're focusing our efforts on the general community, the home, the business community, as well as schools, where our main efforts are focused, because you can see that you need to have emphasis in all of those areas to try to encourage these. So certainly working in the business community is a major effort of trying to get them to do what they can do, and understanding in the business community it's got to be seen as cost efficient. They're not just going to implement things that aren't going to ultimately be fiscally beneficial for them, but I think many businesses are starting to see that that's the case, so we're working strongly there.
Let me jump in and get us to a break. Dr. Mike Crutcher is with the Oklahoma State Board of Health, and we'll start looking at what we can do about it and how you can make you and your own family healthier in the future. Stay with us. You're watching The Verdict.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Shining is taking responsibility. At Blue Cross and Blue Shield of Oklahoma, we know managing your health care can be overwhelming, and it's our job to help you meet the challenge. By guiding, supporting, and showing the way, we encourage you to gain control. Because we believe the best tool we can give you is the confidence to take charge. Blue Cross Blue Shield of Oklahoma, shining through.
That land next door was a mess. Take more than a lawnmower to revive that land. I heard the oil and natural gas people was cleaning up old oil sites, and it wouldn't cost us a plug nickel. Oh yes, sir, it was quite a revival. The whole church showed up. Want to make a playground for the kids. It sure is a blessing.
Wilsey, Meyer, Eatman, Tate. We're accountants. We do taxes, business valuations, estate planning, and consulting. And we're right here in Oklahoma, working with the owners of small and medium-sized businesses. Steve Wilsey and Stuart Meyer have the resources and the experience. Wilsey, Meyer, Eatman, Tate in Oklahoma City and Tulsa.
Welcome back to The Verdict. We're visiting with Dr. Mike Crutcher with the State Board of Health, and we're discussing the poor health of Oklahomans in general, and I want to ask you about what's being done in the schools to try and reverse these trends.
Right. Well, I have to say that's where the majority of the activity is going on right now, realizing that trying to establish healthy behaviors early in a person's life rather than trying to change bad behaviors, 20 years down the road, is where we need to invest a lot of time. And so a lot of efforts aimed at schools, both in encouraging better nutrition, efforts recently of removing the less healthy foods from vending machines or getting vending machines out of schools, trying to have healthier lunch programs, the farm to school program of the last couple of years, again getting fruits and vegetables into school, and encouraging physical activity and actually bringing back requirements for physical fitness training in schools. So a lot of activity going on there.
Does that school effort go on across the board from kindergarten through 12th grade?
Right. Most of the efforts now are focused on kindergarten through 5th grade. I mean, elementary school is where most of the efforts are. One of the pieces of legislation as part of the Fit Kids Coalition a couple of years ago required that schools have a health committee to look at issues related to the health of their children, nutrition and exercise, and to plan ways to make it better. So I think there's a lot of efforts in schools.
Are you satisfied with the menu of foods that kids are offered in the school system?
Well, I think it could be better. I think all of us realize that over the years we've progressed from what were the traditional school lunches of the past, where you had a more nutritious meal, to offerings that most kids are going to choose because they perhaps are tastier, that certainly aren't as nutritious as they should be. So I think there's work to be done.
Kids are likely at school to eat the same thing every day,
Absolutely.
and that's not good either. Don't you need a variety?
Oh, yes, and I mean, I have a teenager, so I'm well aware of that, but certainly getting kids to choose healthier foods, fruits and vegetables, and less fatty, less high-calorie foods is a challenge for us.
Let's show the book that you are promoting, and certainly something that we want to urge people to get a hold of. It's called Strong and Healthy Oklahoma, and it's kind of reading through this, it's for adults and parents, but there's certainly a lot of information here for the entire family.
Right.
I wouldn't call it a kid's book, but
Right.
you wouldn't have to be, a middle school kid could certainly get a lot
Sure.
out of this if handed to it, and obviously the impact is generational and something that families need to be working on. So don't just think that the school is handling education on your kid's health. I think parents have a responsibility too.
Yeah, let me go back to school just a minute. We talked about diet, exercise, and all in the lower grades. What about any kind of smoking education at the middle or upper grades?
Yeah. Well, certainly be tobacco free is one of the components of the slogan, and that's the only absolute about this. One of the things I frequently say about this is that eat better and move more means that everyone can choose some form of healthier living. You don't have to be perfect. You don't have to be a vegetarian to eat better. You don't have to run 5 miles a day to get more exercise. Some level of improvement in those areas can be beneficial to your health. Tobacco use, however, is not the same. That's an absolute. There is no safe level of tobacco use. So being tobacco free is critical, and we need to continue our efforts to assure that Oklahomans don't start smoking and give them opportunities to quit smoking if they are.
We've had Ann Roberts and others on in the past about the Fit Kids Coalition.
Right.
How does this fit with the agenda of the Fit Kids Coalition?
Well, we work very closely with them, and this is just kind of raising this issue to a little different level. The Fit Kids Coalition has had some phenomenal successes in the last several years of improving some of these things that we've been talking about in school related to nutrition and exercise, and they will continue to do that. And this is, I think, blending very nicely with what's going on with the Fit Kids Coalition.
Talked about tobacco use, and I referred to smoking, but I suppose the smokeless tobacco use is right in the middle of your program as well. Is there a fairly high percentage of Oklahomans that engage in smokeless tobacco use?
Yes, and actually it's one of the problems we've seen recently with the tobacco prevention efforts of the last few years is as the use of cigarettes has gone down actually in schools. Unfortunately, in some cases, the use of smokeless tobacco is going up, and it is in some ways kind of counterbalancing our overall tobacco prevention efforts. Perhaps kids think that the smokeless tobacco isn't as dangerous as cigarettes, but that's certainly not the case. There's a variety of problems associated with smokeless tobacco.
I think most would agree this is a worthwhile program. How will you know if it's having any effect, or how will you know if the efforts are being spent in the most wisely and efficient manner?
Well, there are a variety of data systems that hopefully can help us judge that. Oklahoma ranks poorly. When you look at our cardiovascular disease death rate, you can also look at the risk factors for heart disease, and we also rank very poorly in that. national surveys that address the fruit and vegetable consumption, we can follow that and see that that's improving. And unfortunately, Oklahoma ranks 50th in the national survey that measures consumption of fruits and vegetables. It's hard for me to understand as a rural farm state that we just don't consume fruits and vegetables. There are also surveys that measure exercise that people get, call and inquire about the degree of exercise. So I think by following those surveys, we'll see whether we're making some improvement. And then ultimately, you know, you want to see your heart disease rates go down and the overall health of your population improve. And I think with time, we can measure those things.
A number of years ago, I don't recall exactly when, the state of Oklahoma settled a lawsuit against the tobacco companies that brought a large amount of money into Oklahoma, and I think part of the money was to be used for prevention of smoking or increasing or decreasing smoking rate. Can you see any connection between the tobacco fund settlement that has come into Oklahoma 5 years ago, whatever it was, or maybe longer, and a decrease in smoking?
Well, you know, we are starting to see some decrease in our smoking rates and also total consumption. I think we all have to keep in mind that that's a long-term investment. You know, this is something, tobacco is an extremely addictive drug, for one. And again, we have gotten to where we are over many decades, and we're starting to invest in the programs and the infrastructure that's required to turn that around, and we're starting to see some movement there. But starting something for a short period of time and then giving up on it because you're not where you need to be is not what we need to do. We need to keep at it for a while. And certainly I want to make people aware of the Oklahoma Tobacco Helpline, the 1-800-QUIT-NOW helpline for people to quit tobacco products that are addicted as part of that tobacco settlement monies.
Okay, we'll give that number again at the end of the show. You're getting some private sector involvement and help along the way. Discuss the process there and the progress.
Well, again, you've mentioned Blue Cross Blue Shield earlier, the Oklahoman, the Tulsa World. I mean, there are a lot of partners that we have in this that realize the importance of improving the health of Oklahomans, and that's going to be critical for this to be successful, and will continue. I mentioned earlier I met with Roy Williams with the Oklahoma City Chamber just a couple of weeks ago and had a similar discussion about how business was viewing the issue of the poor health of Oklahomans and the cost of health insurance. I mean, everybody has to be concerned about the cost of health care. And one component of that, obviously, is making people healthier so they don't need expensive health care. And I think business is seeing that and wants to be a partner in improving the health of their employees.
Mike Crutcher, thanks for coming on The Verdict.
It was my pleasure. Thank you.
Great work being done, and we'll take a break and come back and give people information on how they can follow up, get some more information on how they can make their families and friends healthier in the future. We appreciate all the work being done at the governor's office and in your office too.
Thank you.
Good job.
Kent and I'll have a final word after this.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
Yeah, we've got a phone number to give. You want to put that on the same page as the... Welcome back to The Verdict. We want to thank Dr. Mike Crutcher for coming on the show and talking about Oklahoma's health, where we need to work on it, and what we're doing about it.
Well, we got some people in influential positions doing something about it, and I think we'll see good results.
We've got some website information that can get people more information. They should go to, first of all, strongandhealthy.ok.gov. That's strongandhealthy.ok.gov. We'd also like to remind people there is a phone number to call to help you or someone you love stop smoking. It's the Oklahoma Tobacco Helpline, and that phone number is 1-800-QUIT-NOW. And we also want to remind you about our website, theverdict.tv. You can go on that site and drop us a line about a show that you'd like to see on a future edition of The Verdict. For Kent Myers, I'm Mick Cornett. We'll see you next time on The Verdict.
The preceding program was produced by the Production Services Group at Cox Communications, exclusively for the Cox Channel.